In previous videos, we have talked about the pillars of reform which were introduced by the Liberal government and the changes proposed as part of the election by the Labour government. We introduced the governing policy that the Labour government suggests. It will look to roll out from 2022 to 2023. In this video, we will take a brief look at some of the proposed reforms which are already happening. Let's do a quick recap on what we know. Registered nurses will be mandatory for every aged care facility. Registered nurses can provide health, personal care, leadership, and mentorship. They can take responsibility for supervising and leading enrolled nurses, and making sure residents can always get on-time medical treatments. Clients can get up to 44 minutes of care from registered nurses, and this will also become a minimum requirement, with a total of 215-minute care time. Allied health is also going to form a big part of the assessment process, as is the quality of the care, food and nutritional needs of the client. How are you going to be an attractive organization to work for? Besides an increase in salaries, people also want to work in a healthy, inclusive, and positive working environment, feel empowered and supported, and know there are opportunities for them to do bigger and better things. This is what you need to consider for your workforce once you have them. Just like how you emotionally bond with customers, you need to be investing in high-quality training for your workforce. In Suggestions 4 and 5, the government will implement a mandatory nutrition standard that covers 5 essential elements: fresh, healthy, nutritious, tasty, and safe, with consideration of elders' different cultural, religious, and dietary needs. How are you proposing to manage this process? It will require you to give consideration to the cultural dietary requirements for your clients and to address those needs moving forward. You also need to consider language requirements based on the diversity of your clients. In this respect, there will be specialized requirements to demonstrate your operations are culturally appropriate in the future, the framework for which will be released shortly. Financial reporting requires organizations to be more transparent on expenditures. Publicly available reports must trace every dollar's spending. To help providers get ahead of reform, strengthen their organizational governance, policies and processes, and lead change from the top, a new governance program has been released. The Governing for Reform program works close with aged care quality standards and other current aged care policies, and is designed to provide practical tools and guidance to boards and executives on how to approach transparent governance of a high-quality aged care organization. As well as placing customers in the center of care, aged care workers are also placed in an important position, as they are the ones delivering the care, and therefore, there is a need to focus on lifting care and quality standards and improving health outcomes for your clients. This will form part of your assessment, and you will need to be able to demonstrate how your organizations address such things as complaints or serious incidents, and use them as a basis for future improvements. Here is an example of how the executive and the board should consider and react toward the aged care reform to achieve their goals. Lily is the CEO of an aged care center. John is one of the board members. Today, they are having a meeting about the reforms and what it means to them. John wants to build a sustainable business, which is competitive in the industry, with a good reputation and brand image. He also wants the organization to be able to maintain a healthy financial status and provide a healthy, open, inclusive company culture to its employees and consumers. Lily wants to deliver high-quality services consistently and improve customer satisfaction. She believes the figures are only the result of good business performance, and performance is driven by satisfied customers and business partners. Let's imagine the business as a loop. An unsustainable business loop occurs when we ignore consumers' diverse needs, which causes average or poor consumer relationships. This dissatisfaction, in turn, creates a poor reputation for the organization and portrays the organization as unreliable and unaccountable. This is poor governance. This is a healthy loop. We all know how emotional bonds are important for the service-based industry. The reform process emphasizes older Australians, no matter what background they have, all deserve safe, high-quality care with consideration of dignity and humanity. Implementing cultural or religious references can be challenging when an organization and its staff lack awareness. But when we add cultural awareness into the service, we can see immediate improvements in that high-quality care which addresses the needs of the client. For example, chefs at residential homes add rice porridge, an Indian lentil curry, and roti to the menu to ensure the Asian and Indian customers can enjoy the food they are familiar with. Simple things, even serving hot tea or water to Asian customers, can be an opportunity to bond with a client. It benefits employees, too, as they learn more about the client, and it's an opportunity for an exchange of cultures and learning. In an inclusive environment, employees are trained to respect differences. 37% of aged care workers in Australia are from overseas. Having a diverse workforce with cultural training is how your organization stands out among competitors, especially when skilled workers and registered nurses are in a shortage. Good governance is a key to the future growth and sustainability of the business. To implement a customer-centered aged care transformation, John needs to establish the frameworks and guardrails for decision-making in the context of providing quality and safe consumer care, ensure the aged care provider is meeting its regulatory obligations, oversee and monitor the aged care provider's performance, the executive team and their implementation of the strategy, promote a culture of safe, inclusive and quality care and services, and ensure it is consistently delivered. Financial security is also a key consideration, and he needs to make sure they have good systems, as well as charging consistently for their services. Lilly should act within the approved frameworks, authority levels and guardrails, to implement policies and practices to ensure compliance with the quality standards and escalate any serious compliance breaches, with an implementation strategy to resolve. Lilly needs to meet the consumer's needs, deliver high-quality care, and meet performance targets, and report accurately. Promote and support a culture of safe, inclusive, and high-quality care and services, ensuring that these are consistently delivered, and not be afraid to escalate key issues and risk to her board. In Standard 8, organizations' governing body is required to be accountable for the delivery of safe and quality care and services. It's essential that the board and the executives work together for the benefit of the client and the organization. The organization is also required to have wide governance systems in finance, human resource management, and feedback and complaints. A clinical governance framework should also be in place and reviewed when clinical care is provided. Complaints are an opportunity for improvement and should always be viewed as such. Triaging complaints is an opportunity to improve what you do. If you would like help with your governance frameworks, or with training your staff in culturally appropriate behaviors, reach out to your local PICAC or contact the PICAC Alliance, and they will be happy to assist you.